Hospital beds in Jacksonville are filling up with COVID-19 patients. There are now 179 people hospitalized at Baptist Health. Of those, 33 are in the ICU. UF Health is reporting that they've seen a 15% increase in COVID patients in just one day. That hospital has 70 COVID patients with 20 in the ICU. Meanwhile, Jacksonville has received yet another grant from the feds to help deal with problems created by COVID-19. This time, it's for $3.2 million. Some local health officials say that it's time to make sure that money is spent the right way. News 4 Jax reporter Jim Pickett joining us live to show us what this money is for and why some say, Jim, we need to shift our priorities.
That's right. You know, Ken, throughout this pandemic, the city has received hundreds of millions of dollars from the federal government in order to deal with this crisis. This latest one, as you said, is for $3.2 million, and it's basically for health literacy. Well, what does that mean? Well, in a nutshell, it's basically in order to help minority communities improve healthcare disparities. Representative Al Lawson announced the $3.2 million in funds. We reached out to him today, but his office says he wasn't available. In a statement, he said he wants to increase access to communities by having healthcare workers reach out directly to people, saying the pandemic exposed inequities in our healthcare system, and educating the public is the best path forward to saving countless lives. Lawson says Jacksonville's urban core is more vulnerable to the disease than other parts of the city. We reached out to the Health Planning Council of Northeast Florida, which will oversee the spending, but it hasn't gotten back to us. We did talk with Dr. Rogers Kane, who's with various healthcare advocacy groups in Jacksonville, including a statewide coalition of black physicians. He says two things need to happen. The groups involved need to talk and focus their efforts to get people vaccinated.
I think we really need to address a vaccine hesitancy. I know a lot of people were trying to get away from that. The approach to this virus has been too politicized by a lot of different people, a lot of different groups, and it has taken away from the clinicians who really need to be the ones involved in getting their patients to come and get the vaccine.
And you know, now with fewer vaccine sites and fewer testing sites as well, this information is crucial, particularly with this upsurge now that we're seeing with the younger people becoming infected, possibly with the Delta variant of the COVID virus. We're live on the South Bank. Jim Pickett, Channel 4, the local station.